to thank everyone for coming to part two. And we have two excellent presenters. Kaliesha is no stranger. She presented for the first one. And basically, Kaliesha Johnson is the patient financial coordinator at MedStar Washington Hospital Center. Let me put these glasses on so I can see. She has over 20 years of experience advocating for cancer patients. She's dedicated to easing the financial burdens that come with a cancer diagnosis. As a patient financial coordinator at MedStar Washington Hospital Center and the Georgetown Cancer Center, she works closely with patients to navigate complex financial challenges and to ensure they can focus on their health rather than the financial stress. Her expertise includes 12 years in specialty pharmacy and experience in multiple cancer centers where she has assisted patients in securing financial aid through assistance programs, insurance applications, and social security benefits. In addition, she specialized in educating patients on their insurance benefits, providing clear explanations of coverage, out-of-pocket costs, and available financial resources. She also helped to ensure patients understand their options, empowering them to make informed decisions about their care. Kaliesha's ultimate goal is to help patients combat financial toxicity, ensuring they receive the care they need without unnecessary financial hardship. Every day, Kaliesha Johnson strives to be an advocate and resource for those fighting cancer, providing them with the financial guidance and support they deserve. Kaliesha will be the first presenter, and again, this forum is very informal. If you have questions, need additional information, that will be provided. So she will be, again, the first presenter, and it will be, if you have any questions, and she will provide a basic overview on health insurance and how to better understand your prescription coverage. Once she is finished, we will then hear from our second presenter, who is Keya Joy Bush. She's a seasoned healthcare operations leader with over 25 years of experience in federal health communications, media relations, and senior level event management. Specializing in healthcare operations, strategic media relations, event management, and digital engagement for Medicare and Medicaid programs. With a proven track record of orchestrating high-impact healthcare events, public relations, campaigns, and government compliance-driven communications, Keya excels at bridging the gap between policy, operations, and media public engagement. Keya is very well versed in the current climate and situation that is impacting our country with the federal government. So she's very knowledgeable in that arena, and she will be talking about that. Okay, so for the first presenter will be none other than Kaliesha. So Kaliesha, you can take the mic. I'm passing it to you.
Thank you so much. Yeah,
Yeah,
let you see what I'm working
yeah,
with this
with that
afternoon.
pretty dress. Yes.
Thank you. And again, warm welcome to all of you tuning in tonight. And tonight, I'm kind of informal tonight because I just wanted to make sure that I could piggyback on the what we did before and answer any questions and things, burning desires that you may have tonight. If you don't have them up front, then we can probably get them later on in the back because you're gonna get a lot of meat and potatoes later, especially from Miss Keya. Okay, so my main thing that I focused and focused on last time was really about the changes in the Medicare prescription drug plan, right? How there's a new Medicare D plan and a payment plan going on this go round. The $2,000 out of pocket is what I call it. So it's a lot of questions was going on about that new thing. Um, and certain options that you may have, like whether you want to sign up for the plan, if it's more beneficial to you to sign up for the plan. If you're not on a lot of expensive medications, that might not be the option for you to sign up for. I don't particularly recommend that you sign up for the payment plan if you're not on a lot of a specific expensive item, right? Um, I wanted to make sure that you guys knew the difference between Medicare, Medicaid, and the Medicare different supplemental plans, and when you get into retirement and things like that. So with Medicare, you have Medicare A, which is your hospital insurance, and Medicare B, you have it's in boy, because we get confused with them sometime. That is your medical insurance, and with that one, you use that for doctor's office, outpatient visits, and things like that. Then you have Medicare. I'm gonna skip C first, and then I'm gonna go back to C. Then you have Medicare D as in David, which is the prescription drug plan, where you get your pharmaceutical benefits from. So Part C, as we know, has been very helpful for a lot of folks. It's not for everybody, but it's for a lot of people. So Medicare Part C is a Medicare Advantage plan, and what that plan consists of is you have a Medicare all-inclusive plan where you have A, B, and D all included in one plan. With this plan, it usually comes along with vision insurance and sometimes dental insurance. As you get older and when you retire, those type of things become important to you. You got to go to the dentist. Traditional Medicare doesn't hold that capability that you can go to the dentist and use that because it's not in dental insurance. So some people opt to have those additional things, and depending on what they got going on later on, that may benefit them or suit them in that aspect. But it's really good to meet with a financial um, coordinator or financial navigator or patient navigator to just go over your options when you're choosing insurance plans and what's best fit for you. Right. So maybe your care team or your health team may have somebody in place for that. Um, don't mind me. I'm looking at my old slide, just trying to make sure I'm hitting some points for y'all, trying to
Mhm.
be to the point with you.
That's
Um,
okay.
Medicaid. Um, Again, Medicare is federal, right? You get that, you pay into that with your Social Security as you're working throughout the years, you're paying into Medicare. So then you become eligible for Medicare later on down the line. Um, part Medicaid. Each state typically has a form of Medicaid. It's an insurance that you have when you're low income. That one usually coincides and works very well as a caveat to Medicare because Medicare traditionally does not cover 100%. Typically, they cover 80% of services rendered. And then after that, you have that 20% left over. Say you got a big expensive bill. How can I pay for that? What can I do? A good option to look into would be like Medicaid, especially if you didn't make the cut when you to sign up for one of those Medicare supplemental plans, right? So Medicaid is basically income driven, so it's definitely requires an income limit. So you have to know those limits in your city or the state, whatever one you live in. I say city because we're in DC. Most of us, in Washington D.C., so it's considered city. It's not a state. Then you have Maryland, Virginia, any surrounding state. They have their form of Medicaid. Um, Medicaid is responsible and it can help out cover your Medicare premium that some people will pay out of their Social Security check, right? So that Medicaid helps bring that reduce a barrier of income and helps bring that money back into your household. So you're able to pay different things throughout when you retire or go into Medicare. It helps cover the 20% for premium and co-insurances that Medicare did not cover. So that expensive medical bill for medical services that you had rendered, it helps that out. So you don't have to have that over your shoulders about, going into collections and how I'm gonna afford these things. How can I afford my health care? Um, what else did I want to touch? I think I briefly said something about a Medicare supplement plan. Medicare supplemental plans are they're designed to help cover that 20% also that the Medicaid will kick into. Those the Medicare supplemental plans or Medigap plans, they do not have an income requirement to get those. So with that, it's a caveat to that. Depending on when you become eligible for Medicare, it's best to look into your options for a Medigap plan right then and there because it gives you a grace period. I believe it's about a 6 month grace period in between the 3 months before, 3 months after, for you to sign up for a Medigap plan or Medicare supplemental plan. I like the plan G's because if you I'm talking a lot. I'm sorry.
Okay.
If at any time you decide to, I don't need this right now, and you want to go get it later, say you have an underlying health condition, you're not able to go back and sign up for that Medigap plan because, or Medicare supplemental plan, because it's like buying life insurance. When you have an underlying health condition, then they can deny you. But if you get it within that premium time that they allow you to do it, it's a grace period where you could just get it without being penalized for having an underlying health condition. Um, does anybody have any questions, or have any questions about how the payment plan works for the prescription drug plan? I can share the little slide if it's need to be. Any,
I,
sorry,
I
I was
do have
just
a
doing an
question.
overview.
No, I do have a question. So if you
Mhm.
want to add something on, like a part D or something later, can you do it throughout the year, or do you have to wait for like open enrollment?
So there are qualifying enrollment periods for the Medicare D. So typically, the open enrollment period is usually, and I think December, through December. I think it's October through December, yearly when they sign up for that. It's usually in the fall. That's the typical enrollment period. If you do not sign up for a Medicare D plan, say you move, or you've retired or something like that, that qualifies you to be able to sign up for a Medicare prescription drug plan. That's a qualifying life event. So you're able to open up a special, it's called a special enrollment period. So you're able to go in and sign in for that. That's just one thing. Say you move, you're eligible to sign up for, move for different state. You're eligible to sign up for a Medicare Part D plan, prescription plan, because the plans are catered to your zip code when you initially eligible for Medicare. So if you move from a different state, then you're eligible because that plan might not be available in that state.
Okay.
Any other questions? If you don't have it, we can do it later. I know y'all looking for the meat and potatoes. It's coming. But that's my spiel for now, and until we get into it, we can piggyback later, if that's okay.
Okay, yeah. Well, Kaliesha, thank you for that very helpful and very informative information. And I'm sure there will be some additional questions because, again, like we all know with healthcare, it's constantly evolving
Changing
and it can be very confusing. And several of us are knocking at that red and
that
white
door.
card's
Mm.
door. So this is really appreciated. Um, so at this time, we will have Keya. And like we said, Keya will be speaking, from personal experience. She's in the trenches, so she has some information to share as well that we hope will be very helpful for everybody.
Oh, thank you, Glenda and Kaliesha
Yes.
and everyone. I guess I'm the meat and the potatoes. So, again, my name is Keya Joy Bush. Some of us on the last call wanted to know more about what is going on currently with federal agencies, basically riffing. And if you don't know what a riff is, it is reduction in force. Um, I personally work for HHS CMS, and on Tuesday, my entire office was riffed or let go. So I'm personally in this trenches right now. However, by the grace of God, I took what was called the early out option, or VERA, because I had that option. I kind of saw it was coming. And I see that there are at least 7 other agencies offering those to their employees. So what I want to talk about, since I'm personally involved, and you guys can stop me if I'm going too slow or too fast, because I know it's been a hot Thursday, and it's the end of the day. So, but I'm sharing my personal knowledge because I'm personally going through exactly the RIF. My last day with being with this Medicare and Medicaid for 25 years will be April 30th. And I'm going to share what I learned in regards to what healthcare is in retirement, because I'm going through it. So I hope that I help me, and I'm going to just jump off the video and share some screens. So let me share my screen, and I will share my presentation. Just let me know if you guys can see. Understanding Vera. Can you see this, the slideshow?
Yeah.
Okay.
Yes.
So I
Yes.
want to just basically talk about the VERA. And the VERA, again, is the early option for some in the federal employment agencies have taken if they were either 50 years old with 20 years or 25 years at any age. So for some, it's basically an early out to retire early without getting penalized, if that makes sense. So I'm going to talk about 3 things in this comprehensive checkup presentation: the FEB coverage, eligibility, and other benefits after retirement. Again, what is the VERA and FEHB? Because government has so many acronyms and wonky speak. A VERA is a voluntary early retirement authority, which allows early retirement during workforce restructuring. I think in my agency, the last time they offered a VERA, I think it was in 1995 when Clinton was there. So they rarely do this. So people have been there years. It's like, if they do it, if you can, it's a good option if you can do it. But just want you guys to know, like, agencies rarely do it. And if they do, you probably really should look into doing it if you can. Everyone's personal issues are different. And then FEHB is Federal Employees Health Benefits. Yes, they do continue into retirement with the same premium percentages as employees when we're regularly working, but it's not pre-tax. I didn't realize that the FEHB program has 9 million enrollees, and it is the largest employer-sponsored group health insurance plan in the world. Premium cost in retirement, employees pay the same healthcare premiums through the FEHB program as they would if they were in as a full-time employee, with the premiums being deducted out of our annuity payment, or meaning our pension check, after we finally start getting our pensions from retirement. It's going to be, of course, they're going to tax it out. Immediate annuity is required to maintain the FEHB in retirement, which means when you're doing your retirement papers, you must sign up to continue your health benefits election.
So I have a question for you, Keya.
Go back.
So your slide, we're only seeing just the first one. I don't know if you've moved on to the next. I just wanted to make sure we were on the same page with you.
I thought you guys were seeing all the slides as I'm moving down, so let me see. If not, I can talk it out, but I don't know. Do you guys see me moving them around, or no? You just see the first slide?
No. Does anyone else see them move around? I just wanted
No,
to...
just the first slide.
Huh. Okay, let me stop sharing and try again. Hold on, guys. Let me share again. So I stopped sharing, but let me just try to share again. So I think what you guys are seeing is my screen, or do you see slides?
We see your screen.
Your screen. But you hovered over the PowerPoint. Click on the PowerPoint.
Yep.
Okay. You see that now?
Yes. And yeah, and then hit that. Yep. Perfect. Thank you.
Sorry about that, guys.
That's okay.
That's
No
okay.
problem.
So I was on this slide. It's not many slides because I wanted to get to the questions and answers. So I kind of went over the voluntary early retirement, the FEHB, which is 9 million enrollees, the premium costs, and immediate annuity. And so now the next slide, the FEHB eligibility and waivers. You guys see that?
Yes.
Yes.
Mhm.
OPM will grant pre-approved waivers to employees who have been, one, covered under FEHB program continuously since the beginning date of the agency's latest statutory VSIP authority, or OPM approved VSIP and VERA. These acronyms currently are interchangeably because some agencies, the VSIP, if you guys heard in the news, some was like, oh, they're offering $25,000 for a person to leave, or $15,000 for a person to leave. That's a VSIP. Sometimes the agencies are combining a $25,000 option with the early option so that people can take some money to leave early, because people didn't plan this. It's like, oh, you decided you're working, and the next thing you know, you don't have a job now. How are you going to pay your bills while they processing your retirement papers? So some agencies, that's what this VSIP means. Now, also want to kind of stop, because my mom and everyone's like, oh, you guys getting $15,000, $25,000 to leave. Believe me, it sounds like a deal, but it is not. By the time they tax that $25,000, it's dwindled to maybe 13 to 14, and everyone was not offered that money to retire out. Only certain people.
Wow. Wow.
So all these words that you're seeing on the news, and I cringe when they're calling it a buyout. It's not a buyout, because it's millions of people losing their job. And if you're dwindling it down to $13,000 or $14,000 by the time they tax you on top of the tax, that's not a lot of money. It goes away real quickly.
Exactly.
So that is the eligibility. I just want to kind of like clarify some things of what people are hearing on the news on taking early out options. But some people, the numbers are working. So the VSIP again is the money. The VERA is the early out. So the take number 5, take discontinued service retirement based on involuntary separation due to the RIFs. And basically, as you guys are saying on the news, this administration is basically riffing the entire government, or reduction in force, reclassifying and abolishing positions. Dual federal enrollment coverage is also under a federal spouses plan, and it counts towards the 5 rules. So basically, when you retire and you are either, if you are married, either or have to be on the insurance for 5 years so that you can take it into retirement. Any questions before I go to the next slide? Additional benefits. So sometimes when you get your insurance, or currently your insurance, you take the dental and the vision. That will automatically continue in your premiums when you retire, and it will be deducted from your annuity after processing. Everyone probably on the call is from different agencies, so you will have to contact benefits.gov to see if you want to continue your dental or vision when you're doing your retirement packages. Also, flex spending accounts, or FSA, healthcare FSA, it ends at separation, meaning if you have, like I do, like $2,000 still left in the kitty, because we ain't even 6 months in the year. If I don't use $2,000 before I retire in April, I lose that money.
Wow.
Stop when I'm literally separated from the government if I have any flex spending. So only expenses. So use as much as you can before you separate from federal government. Dependent care, FSA contributions also stop, but the reimbursements are allowed until the balance is used. Then you have to contact fsafeds.gov if you have any questions on that during retirement. Regarding Medicare, at age 65, retirees can choose to enroll in Medicare and or keep their FEHB coverage, or you can elect to suspend it and add and get Medicare Advantage plan. as Kaliesha kind of was alluding to earlier. As a federal employee with FEHB, you don't need Medicare, but these are things when you get to that stage in your life of what you need for health plans. Everyone's different, but just want you to know you can stay in the FEHB plan for the rest of your life. However, if you decide you get another job, you want to continue work, I don't know whether it's at Walmart or just at the library or something like that, and the new job has a better health plan than what you are having right now in your FEHB, and it's cheaper, if you get out of it, you cannot get back into it, ever. So take note of that. I have some FAQs I thought was probably helpful to everyone, and I'll just read them out loud. Number one, will the premiums change when I retire? No, but they may change, as you know, each year during open enrollment season. The premiums go up each year. I can personally tell you mine's with me and my hubby, it's like around $400. I used to always think, why do we work for federal government? That seems like a lot. Sometimes my sister and some people at MedStar, I hear what you guys are paying for insurance and it's cheaper, but that's what it is for federal government. And then the second question, what is the average cost of FEHB retirement premiums? For self only, it was about $414 biweekly or $897 a month. So self plus one biweekly, around $902 or roughly $1,956 a month. For self and a family, $991 biweekly or $2,149 a month. Health insurance is insane.
Yes, I didn't realize it. Oh, wow.
So I thought that was interesting when I was like, that is just the average of what retired federal workers are paying in health and premiums. So each open enrollment season, just double check what the plans are paying. So even though when the last time I said, no, there's premiums, what they were saying was each year insurances go up. So your insurance might go up. Question 3, why is this FEHB so expensive? Basically, yearly increases in the rates are caused by changes in the medical inflation, healthcare services, blah, 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 yada, yada, yada. What I'm seeing now, like what we were talking earlier before the call, to me, in my personal opinion, they're taking everything that's public to make it private, to make it more expensive. Hence, gutting the federal government. So we'll see how expensive things will get, especially healthcare. Number 4, when and how can I make changes to my coverage? Again, open enrollment season typically is the end of each year, mid-November through December, and that's when you can make changes. Number 5, how can you have Medicare premiums withheld? If you are not receiving Social Security benefits, you can request that your Medicare premiums be withheld from your annuity payments, meaning your retirement payments. You will have to contact your local Social Security office to initiate this request. Funny that they keep this answer now because they're also closing down Social Security offices or making it very hard for people to call.
Right.
Number 6, can I cancel my FEHB? You can cancel your FEHB, but you will not be able to re-enroll it. If you choose to suspend, so that's the cool thing, suspend your FEHB coverage, meaning when you start looking at your retirement checks, and you're looking at that high number for how much you're paying monthly for your insurance, and you're like, I want to get out of it. I would just suggest suspending it and not canceling it until you find something that's a little cheaper, but never cancel it. Like I said, because you can't get back in. And then once you decide, you can reinstate it during a future open enrollment season. So you can suspend your health benefits, but don't cancel. I thought that was a good tidbit. Can I keep the FedVIP dental or vision coverage in retirement? Yes. Your FedVIP coverage automatically continues when you retire if you're enrolled as an employee. There is no 5-year requirement in continuing the FedVIP in retirement. FedVip is that additional dental and vision. I personally have an additional, I think it's the vision one. What I was told with my retirement that when I retire, I may have to pay the premiums up because it's different from the FEHB. It was kind of a little weird what she was saying regarding that, but I can keep it. But so I said, well, what if I don't want it now? I want to cancel it now. I couldn't cancel it now. I have to wait till open enrollment season to get out of it. And that was before I put my retirement papers in. So that basically are the Q's and A's. The final steps and resources. I applaud. Kind of want to make people understand that regarding all these changes, especially with VERAs and all these options to early retire out, just check your eligibility with your agency benefit office before you retire. And then financially, you need to weigh personally your premiums and out-of-pocket costs. I kind of showed you with both FEHB and Medicare as well. Coverage, consider the coverage offered by your plan and Medicare because everyone has different plans, specifically prescription drug coverage. Medicare Advantage, if you choose to enroll in Medicare Advantage plan, review the plan benefits to ensure your needs. Like I tell my mom, I guess, just double check if your doctor or your place where you normally go is in that plan. And every year during open enrollment season, they change. So just double check or call if you make any changes. Regarding mental health, at age 65, Medicare overrules FEHB coverage to not include mental health. I thought that was also an interesting tidbit at 65.
wow.
And then we have some resources and links because I'm not sure, different agency may come from different agencies or federal employees or someone else you can help a loved one, since this is like a rolling, changing, fluid situation day by day with federal employees. I don't know when federal employees became the target of attack, of hatred. Is insane. But OPM is where once your final retirement packages is done from your particular agency, OPM, now imagine this, all these people who are retiring or leaving, and they're riffing them as well, are going to be handling the entire federal government retirement packages.
That's
So
insane.
So hence when I said that some people are getting that additional money because it takes OPM, and I'm air quoting what they normally say, 3 to 6 months for you to get your first retirement check. I'm not banking on 3 to 6 months, but I'm praying that as soon as it leaves the retirement package from my agency, I can no longer talk to them. Once it leaves my agency or your federal agency, you have to contact OPM for anything regarding your retirement questions, money, everything. So just imagine in this time, I feel so bad for those HR people for every agency and OPM because this is insane. Typically, in a normal setting, each year about 100,000 people retire at the end of the year. That's normal. Now, times at 1,000, what we're seeing now, triple that. So these are resources from OPM regarding the VERA, and then a fact sheet for the severance pay. So thank you for that, Kaliesha. And types of retirement from OPM. So the top thing for each agency, if anybody wants to know, is definitely at OPM. But you start first with your agency. Once you do your retirement packet, ask your HR people questions before you decide to retire. And then it goes to OPM. So that is everything, guys, I wanted to share. If you want me to go back to any slides or any questions you have of me, but
I got a question.
Yeah.
So one of the slides you had mentioned, I just want to make sure that I have clarity on that when you mentioned about 5 years. So was it that you have to have 5 years invested in the federal government in order to carry the benefits over to you and your loved ones in retirement?
Correct. Yes. 5 years is what I was told.
And I had another one.
Now this, I can see how this is very overwhelming.
And the
Uh-huh.
the 5 year rule, Kaliesha, is because you're now invested in the government. So anybody that has under the 5 years invested in the government, you don't get access to like your retirement that they you only get your portion of the retirement. After 5 years, you're able to
Mhm.
get access to their portion of the retirement. And then the TSP, their portion of the TSP. Under 5 years, you don't get that. But at the 5 years, you're able to collect their portion as well.
Right. And then also a tidbit about OPM when you retire, because my mother has it as well. They don't send you when for tax purposes, you don't get documents every year. You don't get them every time it comes around tax time. So I would recommend for those that do have them to keep that original statement or tax form that you get to make sure you add that into your taxes. That's just a caveat. I thought to throw that out there. Sorry.
No, that's every bit as helpful.
Yeah, but that's not only just for the government retirement. Keep it for um, state too, because for some reason, Social Security gives you that document, but everybody else don't always give you those retirements from those pensions. So just make sure you keep that in mind when you're doing your taxes and each year for retirement that you, if you're still receiving those every month, every year, just make sure you're adding those things in. Let's see.
Noted, because I'm on my way to retirement.
Yeah.
Well, micro retirement, because I will be looking for another job. So,
Mhm.
but thank you,
And
guys. If any more questions,
yeah. Um, yeah. Did they talk about age requirement for some of the services when you retire? Because what I do remember for Medicare, for folks that retire and they may retire before they're 65, you were speaking about the insurance premiums. I know that when you're under the age of 65, the premiums are higher, just FYI, than it would be if you turn when you turn 65. This one, make sure I throw that in there. Did you find that? I think I saw that before too. I just want to make
yeah,
sure that everybody knows that
yeah,
part too.
you're right. You're right
I
about
think I
that.
piggybacked. That was what I said on
Mhm.
on number one, but I wanted to make sure I throw it back on here in case they forgot. Sorry about that.
No, you're right.
Mm-mm.
Just
Everything's
think
expensive. I don't.
everything expensive. I'm just thinking of anything that I want to just add on that I might have forgot about earlier, or just from last time too as well. But anybody? Oh, you got a question, Kia?
Hi,
Um,
my name is
Michelle, here.
Hi, my name is Michelle McWilliams. I have a question in regards to retirement. So my husband is retired military, right? And then he's also a government employee. He believes that he's protected, which I do not, right? Because and there they people in his agency or department or were who were on probation, they were let go, right? So now they had to bring them back. So I am trying to understand, is he protected or is he not? I know he's a protected veteran, but it doesn't seem like any of the old rules apply, right? So we depend on our medical insurance through the government.
Is it TRICARE you have? Because
We have TRICARE and we also have Blue Cross Blue Shield, Federal Blue Cross Blue Shield.
got you. I would say stay in the TRICARE.
Okay.
But when you
Mhm.
say protected, are you mean his job or you mean insurance?
I mean, as a veteran.
I can tell you nothing is
That's what I said.
normal.
That's
And
what I said.
all of the veterans at the VA were let go as well, at the federal people. So no. And,
Okay.
and what people need to understand, majority of federal employees are veterans.
Yeah.
Mhm.
Nothing is normal
Well,
right now.
I thought, but he seems he's like under some illusion. I don't know why. And I'm like, I'm worried about our insurances because he carries insurance, right? So your recommendation is that we stay with TRICARE no matter what, because Blue Cross Blue Shield, there might be some things. Also my husband is 67 years old. Yeah.
Yeah, Michelle. I like I think people either like can't believe what is going on, because everybody else is like, why is it in other countries? Like my friends, they like, why isn't nobody else doing anything? Like, I think people are just in shock, like what is going on. And there's no rhyme or reason whether you're a veteran or you've been there 40 years, 20 years, or 30 years.
Okay.
They are letting everyone go that ain't falling in line with their mission, period.
Well, thank you so much for entertaining my question. You've made me feel better because I just knew. I said, nah, nobody's protected. No, nope.
Now,
nope.
the only government agencies I think that they said won't be as much as DOD, you know, immigration division, those type of policing agencies. That's it. But they're seeing that even on the probation side, oh wait, we didn't mean to cut the people who pushed the button to the nuclear, you know, and then they bring them back. So they don't even have a clue of who they're getting rid of. And then they realize it after the fact. Wait, we need XYZ. But it's just not, I'm in it. I can tell you there's no rhyme or reason.
Right.
They don't care who is being cut, why they're being cut, or when they're being cut.
Now, I had a question for you, or Kaliesha. You mentioned with OPM, so they're in charge of helping to make sure people get their funding that have been let go, correct? Or
For
the
governmental retirees?
what's the agency that's supposed to give everybody their money? What agency is that?
OPM is for the federal government.
Okay, okay. So I'm sure, like you said, it's going to take a while for them to allocate this money. Are they even giving them more staff to help to make sure people are getting their pay? Or no, it's just mayhem. Okay.
No,
This is
no.
terrible.
It's just mayhem.
Hey, Keya, I wanted to piggyback on what you said because I'm with HUD, and the way we're getting piggyback on what Michelle was asking, the way and Michelle, yes, the veterans walking around in HUD, they do feel like they're protected. They do, and they're what we got from information from the union was that veterans was high on the list, meaning they will look at that first and try not to cut them basically first. So they had an order of things, your tenure, whether or not you were a veteran. I didn't see age, but I did, they had a list of things, and veterans for HUD was at the top of the list, that they would be the last ones, but nobody is safe.
Okay. My husband works for the VA.
Oh, he works for the VA. Okay. Well,
to be honest, the agencies that you guys would think that would be less probably taxed is the ones where you look at the Project 2025. They're doing exactly everything
he said
play by play with Project 2025. Department of Education got everything. I'm with CMS, Medicare, Medicaid. The only reason why we had less people over the overall of HHS and Dr. Oz, guys, was just confirmed to be the administrator of Medicare and Medicaid.
God, that witch doctor.
oh my
So
God.
the only reason why we didn't have as many as maybe as USAID and the other agencies who had 10,000 or these high numbers is because the mom and pops or grandmas and them, they love Medicare and Medicaid. So if you get rid of everybody, the agencies where the mom and pops and the rural conservative people like, that's not going to look good on them. So maybe this is why, Michelle, the veterans feel like, oh, they're not going to touch me. Some of the conservative veterans put out there maybe like, we can't be touched. But if you're not like them, I'm just saying that it's a crazy get rid of everything. No one knows.
And also, I'm not fear mongering at all because I believe in God and I believe that He's going to work things out for whoever He needs to work things out for. I just believe it. But I just want to say, a good friend of mine, high up in DHS, was texting me while she was in a meeting with Doge today. She said the youngest one was 19, the oldest one was 22, and they were sitting there getting access to all their systems. So she
Oh,
was texting me while the meeting was going on, and I just couldn't believe. And she wasn't fearful, but now she is like, she doesn't know what is going on.
Mhm.
These young kids coming in here and doing what they're doing.
have no knowledge,
No,
no
no,
life
no
experience,
real
right?
clearance.
Right, no real clearance, no life experience. Could care less about, a lot of the different programs for seniors, the underserved, your vulnerable population. They could care less about that
Yeah.
because it means nothing to them. They're 19 or 22.
Absolutely amazing. Do we have any more questions? First, I want to say, Kaliesha and Keya, thank you so much. This was extremely informative, and
Yes.
I just want to thank you so much for you taking your time out this evening, and well, the second evening, and doing this with us. And I hope that those that have joined, that they receive some knowledge, more knowledge than, because I know the agencies weren't supplying a lot of knowledge, because that's what everybody is saying. They don't understand, they don't understand, they don't understand. So um I think that this was good, and I just want to commend you two ladies for taking your time out and doing this for CCRC, and we're so grateful for you. Do we have any last questions? Oh, I see there's a hand up. Yes.
Yes, good evening. First of all, excellent presentation. Thank you so much for just giving more insight. And as I deal with people who work with the government, I can share with them the information that you have shared with us. But my question is, and I don't know if anyone can answer this, if, for example, Elon Musk is no longer a part of this administration or working with those, do you think jobs will be saved?
No. No.
Thank you.
What
His people are in place.
yeah,
Yes.
what
Go
they're
ahead,
doing
Keya.
what they're doing is, again, is the Project 25, and I'm not an expert, but I'm in it. If you notice, when he did the executive orders early, it had a timeline. He needed to have all the agencies submit reductions in force by a certain date. Then April 13th, 14th, that's going to be another tell us how you're cutting employees. In June, there's going to be another review on how you're reorganizing for every 5 to 4 employees. You can only have 1 employee to every 5. Then by June, July, the agency should be reorganizing and realigning and reassigning. By September 30th is when it will be done. All changes to the government, things going to be reorged. So every agency must figure out ways of cutting.
Speechless. Yeah.
Thanks. I didn't know that. Thank you.
Absolutely.
I've been looking, just doing some research and reading as far as someone that needs medical insurance, but they might be dealt with, it's so expensive. Would you recommend people even looking at like medical credit cards or just some other, secondary line of defense to kind of help them through this time? This question's for either one of you.
I will take that. I will say, because my coworkers, my friends from 20 years, well, been laid off. They don't have the option to do the early out like I just showed you guys. So when they get RIF, they're only going to get unemployment. I would say DC area, all the DC government websites, Maryland, Virginia, they have wonderful resources for health, health or money for food or stuff like that. So I would say check each state government sites if they don't have any help or anything. I will say DC area is helping as much as they can between Fairfax all the way down to Maryland has been helping immensely.
Yeah, and it's terrible. I was talking to a good friend of mine last night. She is a cancer researcher in Baltimore, and she was saying, of course, they've cut a lot of the federal grants, right?
Mhm.
And she's like, but the patients are still there, and they still need the care, and they're letting people
Exactly.
go. And it is infuriating. It is infuriating. They're not thinking about the ripple down effect of the people from the employment side as well as the care side in every aspect. And it's just it's atrocious. It really makes all of us upset. It's just, yeah. Okay, thank you. I'm sorry. Just as upsetting.
No, no.
It is very upsetting. Yeah, because I think I shared with some of you that one of the oncologists, at our hospital, a lot of them from the different countries, they're here on visa. So he was returning back to Saudi Arabia. This was a couple weeks ago, to renew all of his stuff. Well, he's detained. He's legal, you know what I'm saying, law abiding, not a criminal. So he's detained. He can't get back in the US. So there's a shortage, so the other doctors are trying to, fill the void and the vacancy, and they don't know when he'll be able to return. And I'm sure that's now one story of many.
Let me read some breaking news because I'm in the news. So with regards to HHS, RFK guys, the Secretary of Health, ABC News just stated that he's announcing that this is how chaotic it is, reinstating some programs and employees by mistake. On the heels of terminating 10,000 jobs from the Department of Health and Human Services this week, Secretary Robert Kennedy just told ABC News that some will be reinstated because they were mistakenly cut. Kennedy's comments were in response to a question in a branch of Centers for Disease Control and Prevention that monitors levels among children and manages prevention across the country, that the program was gutted on Tuesday. There was some, and I quote, there were some programs that were cuts that are being reinstated, and I believe that was one of them. Kennedy stated that other programs across HHS will be reinstated as well. So 10,000 people got your laid off and your fire emails, and now they're like, wait, oops, we made a mistake.
This has to, you talk about psychological warfare and mental abuse at its best.
Yes, yeah.
Nothing but chaos. Do we have any other questions this evening, ladies? I believe it's all ladies on here. Well, I know it's getting late, and um I don't know if all of you have to go in tomorrow. Some of us don't. But again, I just want to say thank you so much to Keya and Kaliesha. And if anybody else has any other questions, um, I just want you to know that you can go to our website, ccrcforme.org. You can send questions, and we can get the questions over to Keya and Kaliesha. Um, we also will have this on our Facebook page. The other video was put on our Facebook page. We'll put this on our Facebook page too, so that you can go back and you can look at it and you can see some of the slides that the ladies had there.
And our
If
YouTube
you,
page too. Yep.
I'm sorry, Angela.
And our YouTube page.
Our YouTube page, yes, a Facebook page. So by all means, please visit that if you want to look at this, or even if you want to share, please go ahead and share, like our page. CCRC, we don't know what's going to happen, but we still want to try to be an avenue to those that have are suffering with cancer and in active treatment. So we try to do whatever it is that we can to help those. And we rely on people like you to help us help those. So please visit our page. The video will probably be up within the next 24, 48 hours. Please share it, like it. let people know that we're out here too. And if we need to do something like this again, in the future, we want to make sure that we're able to help those, not just those in need, but to be able to help those. So if there aren't any other questions, I'd like to say on behalf of CCRC and everyone, I'd like to say thank you very much for joining us tonight.
Thank you. Have a lovely evening.
And thank you,
You too,
everyone.
ladies. Thank
Have a
you.
good